Hi, I'm Dr. Diane Cleverley, Personal Healthcare Information. Welcome to this episode of How to Hack Healthcare. This is what women need to know. In this video, we'll be talking about menopause and perimenopause. Menopause, it's probably my least favorite subject in this slide group, but I do love this graph. You can see the middle of it is the actual area of perimenopause. Now, perimenopause starts in the early 40s, and that's when your cycles start to vary. Then from the late 40s to early 50s, you start skipping your periods and having hot flashes, irritability, sleep disturbance, and bone loss. Fun, right? So you look at the picture in the middle and you can see what's going on is when you're younger and your cycles are regular, they're just up and down, and you know what's coming. When you're in menopause, which is defined as 1 year with no periods, you have a straight and steady level of all the hormones. They may be low, but they're straight and steady. But during perimenopause, everything's all over the place. So it's just wild and crazy. Hot flashes will usually peak at about 2 years into perimenopause, and they generally last 5 years. However, studies have shown that 1/3 of women at 10 years or more after menopause still continue to have hot flashes. Some of the risks that they've found for this is being of African American descent and being obese. So that can actually increase your hot flash severity and longevity. However, other studies have shown that exercise, if you get regular exercise, that can help decrease the severity of hot flashes. So what about hormone replacement therapy, right? Everyone's heard about that. Well, this is the thing. There are benefits on one hand and there are risks on the other. So some of the benefits are you'll have lower fracture rate, you'll have lower risk of particular cancers. One of the risks are you'll have higher rates of other cancers, particularly depending on what hormone replacement therapy you're using. And the one that stopped some of the studies was that there was a high risk of stroke, blood clots, and heart attack. So that was a very real and serious risk. Because of these risks and what they found in the study, it's recommended by the FDA that you go through treatment only during perimenopause and for the shortest time possible. And the treatment itself is going to focus on things like osteoporosis and the vasomotor symptoms, which are the hot flashes. There are some newly approved drugs on the market, including what they call SERMs, which are selective estrogen receptor. And what they do is unlike estrogen, which hits all the estrogen receptors in every single cell of your body, the SERMs will just pick and choose, and they happen to, the ones they've developed, pick and choose the areas that are affecting vasomotor symptoms and osteoporosis. So they're very helpful in that way. They kind of mitigate some of the side effects while they're being very effective in hitting the bad symptoms you don't want to have during menopause. Complementary alternative medicine, CAM, is very popular in European countries for menopause. So people have tried a lot of different things. There's mixed evidence and there are side effects. So if you are taking any of these agents, you probably should mention it to your doctor or ask their opinion on it and find out what it might interact with and what kind of side effects it might cause. And the benefits of hormone replacement therapy, as far as fractures and reducing those cancers, they can be obtained with other methods. You can do weightlifting and supplements, you can do colonoscopy, high fiber diet. There are other methods, so you don't need hormone replacement therapy to get all of those benefits. If you really want to get control of menopause symptoms, I suggest you download MenoPro, a new app from the North American Menopause Society, or NAMS. It's available on the Apple iTunes Store, and it will help you keep track of your menopause symptoms. It'll also help you lead a discussion with your physician about treatment options. I hope that you enjoyed this episode of How to Hack Healthcare, and always remember you deserve to be well treated. And if you like these webinars, you can check out some of the other How to Hack Healthcare webinars. And if you need more help, if you need personal help pursuing diagnosis and treatment, we can also do a workbook and a workshop for that. So you can register at that at www.personalhealthinfo.weebly.com, which is my website. And any feedback at all or suggestions for topics is greatly appreciated. I have a number of topics I'm planning to cover, but it's always better to hear from you guys and find out what you're interested in learning about, hearing about, what can help you, anything like that. If you subscribe, all the better, because then you'll get all the latest updates. So Thank you very much, and we will see you next time. Bye.
Thank you for listening, and for more information, please visit us on the web at personalhealthinfo.weebly.com.